In this video, I'll discuss the differences that you need to know between private and government dental colleges. These are small things that we tend to ignore at the initial stages, but is very important when it comes to daily student life. But this actually varies in different private institutions. What happens then? How will you complete the quota? How did I complete the quota? Hi guys, welcome back to my channel. I'm Dr. Aishwarya. I'm a dental surgeon and welcome to episode 8 of BDS series. One of the most common questions that I receive from dental aspirants is, should I join government or private dental college? I have briefly touched on this topic in my earlier episodes, but still I receive comments and mails from a lot of you guys asking, is this private college worth joining? Is my college good enough? Should I join only government college? And also, is government colleges always better? So I decided to make a separate video, a dedicated video in this topic. And in this video, I'll discuss the differences that you need to know between private and government dental colleges. And I hope this helps those of you who are currently in admission process and feeling confused. But before we begin, here's a quick disclaimer. This video is not meant to promote or criticize any specific institution, whether government or private. Every college has its own strengths and challenges, and my only intention here is to help you make the best decision for yourself. Also, please note that I can only give general overview of all the colleges and not exact specific details about each and every college, and I can't disclose exact amount, the exact features, exact specifications about each college. Also, that is not possible, but of course every college is different. So with that said, let's get into the video. So let's begin with the admission process. The admissions are done through centralized counseling under both All India quotas and state quotas. For government college, you need to get higher scores because the competition is very high, but for private colleges, slightly lower cutoffs are also okay, but top private colleges can still be competitive. So just getting a NEET score is not going to help. Your rank, your preferences, everything matter a lot during counseling. Moving on to the second point, which is infrastructure and facilities. Government colleges are often older and well established, but sometimes they may have limitations in the infrastructure. But private colleges have newer buildings, well equipped instruments, and modern facilities too. But what actually matters is how well the equipment is actually maintained and whether it's useful in the training process or not. Coming on to the third point, which is very important in dental education, which is the patient flow and the clinical exposure. Government colleges generally have higher patient flow, especially in urban areas. But this actually varies in different private institutions because some colleges have really good patient flow, but in some colleges, it is questionable. Now here's something I want to clarify based on my experience from a private institution. In final year, you will have quotas in every department. Okay, for example, in conservative dentistry and endodontics, it is one of the 8 departments in your final year. In that department, you have to complete certain quotas to get eligible to write your university exam. Those quotas are mandated by Dental Council of India. And in most of the colleges, the patient allotment goes like PGs, interns, and then final year students. So sometimes finding patient to complete your quota can become really a challenge. So what happens then? How will you complete the quota? How did I complete the quota? We have to bring our own patients. You will need to bring your own patients. Your family, your parents, brother, sister, your cousins, your relatives. That job is not easy and that's not tough too. That thing soulfully depends on your communication skills. Okay, if you have a lot of friends in your school and they are willing to get treatment from you, you are sorted. Okay, but if not, you should have that communication skill. Here, you will learn how to educate and convince patients, which is very important in real life dental practice too. So yes, this can be tough, but it's a learning opportunity. Moving on to the fourth aspect, which is fees and finances. In government college, the fees will range somewhere between 15k to 1 lakh. But in private colleges, the fees can range from 2 lakhs to 7 lakhs per year, or even more in some cases. If you're opting for a private college, you can explore certain education loan options. Moving on to the next point, which is faculty and teaching quality. Government college have great faculties. In government colleges, there will be a lot of experienced professors that you won't get that much attention from your professors in government college, but in private college, of course, the student faculty ratio will be good. But wherever we study, we should make the most of the resources that are available. So moving on to the next part, which is campus life and environment. In government college, the buildings will be so traditional, it will be vintage, and it will be quite old. But in private colleges, there are better campus amenities, newer hostels, gym, modern cafeterias, and a lot. But again, student life depends on how you work, how you make friends, participate in events, and make connections. Another important factor is location and connectivity. Some colleges, both government and private colleges, will be around the city area, but mostly they will be in the remote area, so you have to travel a lot if you are a day scholar. Things to consider when it comes to location of the college is the distance from your home, connectivity if you need to travel very often, and whether the location affects the patient flow or not. These are small things that we tend to ignore at the initial stages, but is very important when it comes to daily student life. Let's talk about the future opportunities. After BDS, you can do MDS, you can start your own clinic, you can practice in your seniors clinics or professors clinics. You can also go abroad, or you can explore researchers or academics. Now, to be honest, it's often said that government college students are more exposed to patients, so they have better work experience and skills than private college students, so that they are confident enough to open a clinic right after they finish their degree. And that's also true to some extent. But private college students again can become equally skillful if they utilize the opportunities properly. So you can train under your seniors or professors. You can also join private practices for experience. But the most important key here is to keep learning and keep practicing lots of cases. My final thoughts on this is we cannot give a proper distinguishing table between government and private dental college, because there are a lot of things that are different from each other. If possible, visit colleges that you have in mind during the counseling process and try to get a feel of the environment. Like, communicate with the seniors. You'll only know what it's exactly like after you join that college. So don't overthink. Make your choice, trust your journey, and move forward. You'll do great. Actually, this video is supposed to be how to make notes on your BDS subjects, but based on the comments that I get and also the mail that I received, I thought it is very important to address this first. But the upcoming videos are definitely going to be about it. And that's a wrap for this video, guys. I hope you all found it helpful. Please do like, share, and subscribe to my channel. And I'll see you guys in the next episode of BDS series. Bye.